Hi everyone, Dr. James Fedich here, Clinic Director at Village Family Clinic in Hackettstown, New Jersey. Here to explain one of the most commonly asked questions that we get in the office this day and age. Now, people ask me about spinal stenosis. What is spinal stenosis and what can be done for it? It's one of the most common conditions that we do see this day and age. As we get older, we're all very likely to get spinal stenosis. If we live long enough, it's probably going to affect most of us. I want to give you a brief explanation of what it is and maybe some treatment that you might be able to get for it. So here's my friendly spine model here. We have 26 bones of vertebrae down the spine, and then up top is the brain hopefully, and the spinal cord runs down the middle. And if we take a look at this little bit zoomed in model, we'll see that this yellow here is the spinal cord, and it's in a tunnel that we call the central canal, which isn't important, but that's a tunnel there. And if we look at it from the side view, you'll see the nerves exit through another little side tunnels that go to different areas. So the most commonly affected area of stenosis is the lower back, so we'll think about the tunnel coming down, and these nerves exiting usually go down into the legs when it's the lower back, but it can also happen anywhere in the spine. So these next models will show you is kind of what happens. So again, we're looking at the same idea with the vertebrae and the tunnel for the nerve in there, and that nerve should have a lot of room in there. That's actually your spinal cord and the main nerve. So what I tell patients to think about, central canal stenosis or spinal stenosis affects this part, which I tell people to think of like the tree trunk. So this is the trunk, and then there's the branches branch off to go to different areas. Whereas a lot of conditions that we even treat in the office, such as sciatica, things patients know more about, are actually affecting the tree branches, whereas the central stenosis or just stenosis affects more the tree trunk. So anyways, that tree trunk should have nice room in there to move around as we go through, but as we get a little bit older, we see these models here as that space starts getting a little bit smaller. So that's just a little less wiggle room, but you're not going to feel that. Typically maybe you're 40, 50 years old when that starts happening. This model here is showing us getting a little bit tighter. You can see I really can't wiggle that anymore. We're starting to might get some symptoms there. Maybe you're 60, 70 years old. And then as it gets further progressed, the tunnel gets very, very tiny in there. It also affects other parts of the vertebrae as well, but that's what the stenosis is, that tunnel starting to close off as we get older. One of the things I was taught in school, if we live long enough, this is going to happen to all of us, whether you get it at 50, 60, or in the office needing treatment all the time, or you're 110 and you've already passed away, is the difference in how uncomfortable it is. A lot of factors affect when you will get the stenosis, but that's just a brief overview. So there's a lot of different treatments available for it. Two of the only successful treatments that I've seen in 20 years is spinal decompression and epidural injections. So we do have a medical doctor on staff. What the epidural does is they put a fine needle in the area, they put some cortisone in there to help decrease the inflammation in there. Obviously it's a little more invasive. We try not to do it if we can. What we usually like to do is spinal decompression. And what spinal decompression does is it's a gentle form of traction that helps open up the spine a little bit and give some breathing room for those nerves. So I tell patients if the tunnel's supposed to be this big and it's closed down to here, if we can open it just a little bit, my finger doesn't feel that closing in. And maybe it's not back to here, but if it's just not crimping on the nerve, you'll feel pretty good. So we're one of the only centers around that has spinal decompression and state-of-the-art advanced technology with gently tractions the spine in a very controlled manner using computers that traction and release it in a very controlled manner. So I'm going to go to the other room with Catherine here and show you what these tables look like before we end the video. That's just through our examination room. Come out to the hallway, see Susan, Randy.
I'm going to give you a nice video when I get a chance. I'll say how nice the place is.
And then here's our specially designed decompression room. You can see we have two spinal decompression tables. They are actually identical, same machines. We have two of them, and one we can do cervical, which means neck, and we can also do lower back or lumbar. So many of these tables can only do one or the other. Both these tables can be interchanged actually and do neck or lumbar decompression. So if you're looking for a place for spinal decompression, know someone with spinal stenosis or any kind of arthritis in the back, tell them to give us a call at 908-813-8200 or online at Hackettstownfamilyclinic.com.